The coronavirus positivity rate for Iowa is now at 4%. In Polk County, it's at 6%. And getting the COVID-19 vaccine is still top of mind for many Iowans. Helen Eddy, the director of the Polk County Health Department, joins us now with more. Hello, thank you so much for being here.
Well, thank you for having me.
What are the COVID numbers looking like right now? Are we seeing any issues in any particular population?
Well, we're seeing a steady improvement overall in the number of cases in Polk County, but we're not out of the woods yet. Of particular concern to us is the increase in the number of cases in our youth under the age of 18. And what we are seeing is that as we do case investigations, we're seeing that those exposures in our youth are happening in extracurricular activities, including sports and club sports. And if I had one message to share with our community about this, it would be that to the parents, that it is very important that you keep symptomatic youth at home and away from activities if they are in fact symptomatic, and get them tested. Because if we don't do that, we risk spreading this to teammates and other youth in our community.
Oh yeah, that's great advice, a great reminder. We know that vaccination is on everyone's mind right now. What's the most recent update on the vaccination campaign?
Well, yes. I mean, from the beginning of the availability of COVID vaccine, we have focused here at the health department on getting people started on the series. One of the really difficult things that we've dealt with is the variability in the vaccine supply. That's made it very difficult to plan ahead. We anticipated that our Moderna supply of vaccine would at least remain constant, but in fact it decreased in the month of February. So that leaves us with 14,000 people that have initiated the Moderna vaccine series that need to complete it. So to get these people completed and complete that series, we are focusing our Moderna vaccination efforts exclusively on second doses. The good news is that recent evidence points to the fact that people who have had one dose of either Pfizer or Moderna have significant protection, upwards of 80% to the COVID virus. So we are going to work diligently to get these 14,000 people vaccinated, but in the meantime, please continue to wear your mask. I do want to emphasize too that during this time, while we are focusing second dose efforts of Moderna vaccine to those people that need it, first dose and booster dose vaccinations with Pfizer vaccine will continue. So not all vaccinations are second dose only in Polk County. We still have Pfizer vaccine that we will be providing that first and second dose with during this time.
Okay, well that's good news. Who are we currently vaccinating, and when do you anticipate moving on to that next tier?
Well, that's a great question, Megan. We are still vaccinating people in phase 1A that had not received it yet. Those include healthcare workers, residents of long-term care, and employees at long-term care facilities. And then we have moved into phase 1B, tier 1. And phase 1B, tier 1 includes people age 65 and older, first responders, pre-K through 12 staff, early childhood and child care staff. So that is a large group of people. In Polk County, that is over 100,000 people. Wow. That qualify in that tier 1. And so we do not anticipate moving to the next tier much before late spring.
Okay, so hold tight.
Hold tight.
What are your current recommendations then for other mitigation strategies, such as mask wearing and social distancing that we've all been doing?
Well, the recommendation for all residents remains that if you have been vaccinated or not, wear your mask, socially distance, and follow all of those mitigation practices that we have been talking about for the past year. That is what we need to do to be safe and to get this pandemic under control.
Okay, so good reminder, we're working our way through it. We just still need to keep practicing those.
Yes.
Well, Helen Eddy with the Polk County Health Department, thank you so much for being here and updating us.
Well, thank you for the opportunity to speak to our community.